Welcome back to the Racing Mind video series, where we journey deeper into the human mind than anyone has ever gone before. In this video series, we untangle the ancient mystery of mental illness and teach you what you need to know before your racing mind gets the best of you. This groundbreaking series provides answers to some of the deepest mysteries of the human mind and reveals, for the first time in history, the precise cause of mental and emotional illness and the psychophysiological basis of a wide range of psychiatric disorders and associated medical conditions. These educational videos, which present concepts that are so new that they are just beginning to make their way through the medical field, are based on thousands of hours of direct patient analysis and clinical observation in conjunction with the latest research on psychiatric disorders from around the world. In this segment of this series, we will discuss sensory hypersensitivity syndromes in relation to neuronal hyperexcitability. For reasons that have heretofore remained unclear, some persons are especially sensitive to specific sensory inputs, such as sound, light, smell, taste, and other sensory inputs. Yet because perception is both relative and subjective, persons who experience this abnormally heightened sensory sensitivity may not perceive it as abnormal unless it is particularly extreme or bothersome. In some cases, it might even be perceived as a gift. Also, the degree of hypersensitivity tends to vary between and within different modalities. For example, for a given individual, low-frequency sounds might be more affected than high-frequency sounds, and certain odors might be more or less provocative than others. Obviously, it is not the pleasant perceptions that create a problem, but the unpleasant ones. Although the emotional distress caused by unpleasant perceptions can be quite significant, the distress can go completely unnoticed by others until the affected person communicates it in some way. Most commonly, this is in the form of anger or disgust, particularly when another person is perceived as creating the unpleasant perceptions. For example, in selective sound sensitivity syndrome, technically known as misophonia, specific sounds that can seem trivial or even barely audible to the average person can trigger such intense emotion and even physical pain in the affected person that it can cause him or her to erupt verbally or even physically. Hence, misophonia has also been referred to as sound rage. Some commonly reported triggers include breathing, eating, slurping, chewing, lip smacking, typing, and pen clicking. One study found that 80% of the triggering sounds were related to the mouth, and most were repetitive in nature. Interestingly, however, these sounds tend not to be bothersome unless they are produced by someone else. This, taken together with the subtleness of some of the triggering sounds, suggests that the disorder has a significant psychological component. Because the disorder is aggravated by functions that occur in social settings, misophonia can be highly disruptive to both one's home life and one's work life. In another syndrome, known as photophobia, the affected person is hypersensitive to light. Such persons tend to wear dark glasses and may avoid being outdoors for long periods of time. Although there are many known medical causes of photophobia, some persons are hypersensitive to light for no apparent reason. Although the underlying abnormality in such cases has remained elusive, there is evidence that the syndrome is associated with migraine headaches, temporal mandibular joint syndrome, chronic inflammatory states, and other conditions that have been linked to neuronal hyperexcitability. As previously stated, other hypersensitivity syndromes include hypersensitivity to smell, taste, touch, temperature, and pain. As with persons who are hypersensitive to sound or light, exposure to any one or all of these sensory inputs can, for some persons, trigger extreme psychological and emotional reactions. Over time, an associated visual trigger can develop, or the symptoms can begin to occur even without a trigger. Persons with sensory hypersensitivity are highly sensitive to stress, and their symptoms tend to be exacerbated by stress. This helps explain why they are prone to develop various other psychiatric symptoms, such as anxiety, depression, and insomnia. These vulnerabilities tend to start at an early age and persist throughout the course of the affected person's life. A recent study found that preschoolers who displayed a hypersensitivity to sound, smell, touch, and other sensory inputs went on to develop anxiety by the age of 6. In addition, the intensity of the anxiety symptoms was found to correlate with the severity of concurrent behavioral problems such as irritability, picky eating, and difficulty sleeping. The early onset of sensory hypersensitivity, the tendency for the symptoms to wax and wane in association with stress, and the increased vulnerability to developing psychiatric symptoms strongly suggests that sensory hypersensitivity is rooted in an inherent hyperexcitability of the neurological system. What causes some persons to become more or less sensitive to specific sensory inputs hypothetically depends on a combination of neuroanatomical, environmental, and psychosocial factors. Specific circuits in the brain may be overrepresented or have aberrant connections to other circuits, thus making them especially vulnerable to becoming pathologically hyperactive and overly responsive to specific stimuli. The person's life experiences and the way that he or she chooses to react to those experiences could also help determine which circuits would be the most hyperactive at any point in time. Lastly, hyperactivity in select circuits tends to cause competing circuits to be inhibited. This has the effect of increasing the responsivity of those circuits that are activated most frequently and decreasing the responsivity of those circuits that are activated least frequently. This in turn would reinforce specific psychological, emotional, and behavioral response patterns over the course of time. As discussed in previous videos, the abnormality is rooted in gene variants whose protein products fail to adequately regulate the excitability of neurons. For those affected, the primary goal of treatment should be to reduce the excitability of the neurological system, thereby compensating for the underlying gene abnormality. The most effective natural ways to do this include stress reduction, establishing an early sleep schedule, regular exercise, enjoying a relaxing hobby, avoiding caffeine and other psychostimulants, and minimizing refined sugar. If these interventions are either too difficult to implement or fail to yield satisfactory improvement, then treatment with neuroregulators and other brain calming medications may be necessary, particularly during high-stress periods in the person's life. In addition, cognitive behavioral and other forms of psychotherapy may be needed to reduce the mental tension that adds fuel to the smoldering embers in the hyperexcitable brain. Control your brain, control your life. We hope that you are benefiting from this video series. Portions of this video and others in the series were taken from the books The Racing Mind and Am I Depressed or Am I Bipolar? Those interested in developing a deeper understanding of this topic can also refer to the scientific publication The Multi-Circuit Neuronal Hyperexcitability Hypothesis of Psychiatric Disorders. Please note that these materials in this video series are for educational purposes only and are not intended to guide treatment without formal evaluation. This video series is sponsored by the Binder Foundation, a charitable organization that is dedicated to the enhancement of human life through research and education on disorders of the mind, body, and spirit. If you have found this video to be a benefit to you, please share it with your family and friends. And please don't forget, your feedback is important to us.